So if I'm a healthcare innovator and I am approaching a health system or a hospital system with my innovation, how am I approaching it and being able to speak those three languages?
So you've got to understand and it's really this simple, the language of the buyer.
Mm-hmm.
So imagine this, for instance, and basically I'll talk about what we did yesterday because
Okay.
it was literally yesterday. So when I sat with the administrators of the hospital, I did my research, I did my homework. That's the other thing, people don't do this. So back to the doctorate education, it sure helps with this. So before I walked in there, I understand where this hospital, actually, let's talk about the dollars for a minute. I understood where this hospital was on margin.
Mm-hmm.
Seriously, the hospital was around about 2% operating margin. You got to understand this stuff. And
Mm-hmm.
the point was, when I talked to this hospital, I talked to them in pure financial terms. I talked to them about some of the CMS bundle payments that are coming in. I talked to them about basically how this particular thing that we're talking about, this artificial intelligence application, never use those words. Oh, no,
Mm-hmm.
no. Never use the words they understand. This is a revenue generator. This is a situation that is actually going to change your operating margin. Now, this all sounds like, wait on, Paul, are you selling a clinical application? Oh, absolutely. But here's what happens with most companies. They don't do that story. They pitch to the doctors. The doctors say, oh, that's wonderful, Dr. Roxie. I want one. But then it hits the finance person's desk, CFO, like we were talking to yesterday.
Mm-hmm.
If they don't buy into it, it's never going to happen. So what happened from yesterday, we actually found out that this particular institution, here's what people tell us, and then we don't listen to them. They said, you know what, Paul? The best thing about what you've told me is the concept that you're involved in or you're interested in coming into a partnership with our organization, meaning we are interested in a revenue share. Now, you might say, well, that's interesting. Is that a big deal? There's a company called Athena that will actually tell you that's a big deal. Back in the old days, the CEO of that company was basically, I think, unnecessarily jeered at by the industry, saying, you're going to start an EMR company, good luck with that. But what he did, he spoke dollars. He went and actually talked to people and said, here's the software. We'll just share in the profits, so to speak. And my point to you is basically that story that I gave these people yesterday, the financial story, I'm still talking about clinical software, okay?
Right.
But the story was, if I had gone into these CFOs and said, oh my God, we've got this artificial intelligence platform, it's going to make the doctor's life so much better. They're going to go, oh, next.